and I'm Dylan Black. He's here to help us prevent heart attacks and so much more. The interventional cardiologist and director of the Regional STEMI Program, University of Ottawa Heart Institute. He's joining us right now. It's Dr. Michel LeMay. Hello, doctor.
Hi, Dylan.
Good to have you here. STEMI program, quickly tell us what that's about.
So STEMI is a type of heart attack that can kill you very quickly. It can do a lot of heart muscle damage, and it's important that you get to medical attention. So if you're having chest pain, if you're sweating with chest pain, I think it's it's time to call 911 and get medical attention. So if you look at the little model that we have here, in order to understand a little bit what happens in a STEMI, is that this is, we see here in red a picture of an artery called a coronary artery that feeds the heart. And when you have an accident in the coronary artery and it plugs it up completely, it clots off, you're not getting any blood supply to your heart.
Okay, so that's one of there's many different things that contribute to heart attacks and heart disease?
Well, it's the accumulation over time of cholesterol that gradually fills in those coronary arteries. And some people have some greater predisposition, either because of a family history, or because they smoke, or they have diabetes, or simply some dietary indiscretion where the cholesterol goes up.
Okay. So can you tell us now, STEMIs usually happen, it's a morning thing for the most part?
Well, it's more common to have it in the morning.
Yeah.
We can have it any time of day, but there's a tendency of having more of these STEMIs in the morning because the adrenaline goes up, your blood pressure is higher, so you're more likely to have a plaque that ruptures in the coronary artery, and that leads to a STEMI.
Wow. Okay, so can you briefly explain to us then what actually happens during a heart attack? Because you explained how things get clogged up, but what is going on?
So when you're having a heart attack, you're actually having an artery that plugs up. You get a little crack in the wall of the vessel, and then some of the blood products start sticking, and then they form a clot, and they block the passage of blood down that vessel. So the person who's having a heart attack is starting to experience some chest discomfort or arm discomfort or throat discomfort. They're starting to sweat. They know it's not, they're not feeling good. Start being short of breath. And now it's time to call 911. So if you call 911, the paramedics will come over, they'll pick you up. They'll do a tracing, called an electrocardiogram, and they're trained to pick up what is a heart attack. They take you to the Heart Institute directly. And then what we do, we bring the team in and they unplug the artery.
Okay. There's other symptoms as well, because I understand you have numbness in your arm, your back may hurt as well?
So there can be some more atypical presentations, such as you described, where you can have maybe just numbness or you can have just back. But generally we talk about chest discomfort. It may not be necessarily big pain, it can be mild pain. So we say anything that's between the belly button and the chin is basically, you could consider the possibility of a heart attack.
Okay, let's talk about this study as well. You're here to tell us something very important.
So importantly, there's a study that's called the COMPASS trial that was published in a New England Journal about a year ago. And this is a landmark paper that's going to probably change practice. And what they did is, what we've known for many years is that aspirin, just taking aspirin alone in patients who have stable coronary artery disease, so those patients who have already established blockages in the coronary arteries, who survivors of heart attack, people that have had angioplasties before, those are the patients that we know that aspirin has an impact in reducing events. And we've known that in spite of aspirin, in spite of taking cholesterol-reducing medication and following all of the doctor's advice, that there is still an event rate that happens of the order of about 5% per year. So we've been looking for solutions to try to reduce those events. And what the investigators did, and this was a big study, 27,000 patients, led by a Canadian center, by McMaster, worldwide, and what they did is they compared the standard therapy with aspirin to adding a little bit of, let's say, baby anticoagulant dose, a small dose of a drug called rivaroxaban.
Okay, so is that what you brought with you?
So
right here?
this is the rivaroxaban. It's also marketed as Xarelto. It's been on the market for a number of years. It's been used for patients that have atrial fibrillation, the irregularities of the heartbeat, and it's been used also for people that have clots in their legs. But the concern has been, if you use big dosages, you might get bleeding problems. So what the investigators did is they said, well, let's use a little bit of aspirin with the so-called baby dose aspirin, and let's use a baby dose of this rivaroxaban and combine them together and see if we can prevent clots forming in the arteries. And so they're looking at clots that can form in your coronary arteries, but also in your carotids and in the blood vessels that feed your legs, because atherosclerosis, the cholesterol deposition, is not just the coronary arteries. It's a systemic problem. It can affect all the blood vessels.
Okay. All right, about 30 seconds left here, but more information, phri.ca is the best place to go to?
So this is a place where you can look this study. This is the McMaster, and what they were able to show in this study is that by combining these two agents, you were able to reduce mortality, you were able to reduce stroke, and you were able to reduce myocardial infarction, heart attacks.
Thank you
so
very
this
much.
is an important study for us.
Dr. Michel LeMay, thank you very much. We've got much more daytime coming up.